Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Knowing about tonsillitis is crucial for parents and anyone affected by this common yet painful condition. Recognizing the symptoms early help us seek the right treatment and prevent complications. By understanding the causes, signs, and treatments of tonsillitis, we can better manage its impact on our children's lives and support others facing this challenge. Let's explore the importance of tonsillitis awareness, providing valuable insights and encouragement to everyone dealing with it. Welcome, everyone. I'm Dr. Sarmah from THIP Media, and to help us understand the painful condition of tonsillitis, we have with us the distinguished ENT surgeon, Dr. Utpal Sarmah. Dr. Utpal Sarmah is a highly regarded ENT surgeon, also known as the ear, nose, and throat surgeon, known for his expertise and dedicated practice in the field of otorhinolaryngology. Dr. Sarmah has a special interest in dealing with pediatric airway diseases. He completed his post-graduation in ENT, laying the foundation for a career focused on advanced treatment modalities and surgical interventions for conditions affecting the ear, nose, and throat. Dr. Sarmah's professional journey includes significant contributions to ENT care in both clinical and academic settings. His clinical interests span a wide range of ENT disorders with a particular emphasis on pediatric cases. Patients seek his expertise for complex surgeries and comprehensive management of ENT ailments. Dr. Sarmah's commitment to patient-centric care is evident from his approach, combining advanced medical knowledge with compassionate treatment. Dr. Utpal Sarmah, THIP Media welcomes you, sir.
Thank you.
Thank you so much for joining us today, sir. And sir, we all know that tonsillitis can be a very uncomfortable condition for children in particular. And many parents, they may worry about their child's throat pain and possibility of probably needing a surgery. So to ease these concerns and providing clarity, I want to start our discussion with a very simple question that what is tonsillitis and what are the common symptoms of this condition?
So tonsillitis, before understanding tonsillitis, we need to know what tonsils are actually. So
Okay.
tonsils are basically lymphoid tissues. Okay.
Okay.
So their job is to provide local immunity. They are like the
Okay.
sentinels of our body. So anything that we ingest, inhales, like tonsils are the first thing that will respond to it. Okay.
Okay.
So tonsillitis is basically inflammation of the tonsils. Okay. That most commonly result after an infection. It can be a bacterial or a viral infection. Okay.
Okay.
So tonsillitis is basically inflammation of the tonsils due to an infection. Okay.
Okay.
It can be a bacterial or a viral infection.
Okay, sir. And what are the common symptoms of this particular condition?
Symptoms, if you see, mostly it involves the tonsils are situated in the oropharynx, means our throat. Okay. So the symptoms will be mostly affecting the throat, like we'll have a throat pain, the patient will have throat pain, he will have difficulty in swallowing, he might have some hoarseness of voice. Okay. Apart from that, there might be some general symptoms like fever, there might be associated neck swelling. Along with tonsillitis, patient can also experience a ear pain.
Okay. Right, sir.
These are the most common symptoms of tonsillitis.
And you just mentioned that the condition can be either viral or bacterial. So, are there any differentiating factors between the two types?
See, the symptoms are almost similar. Bacterial tonsillitis and viral tonsillitis. Viral tonsillitis are mostly, they are mild. Okay. The symptoms are milder. You will have more milder symptoms. And in bacterial tonsillitis, the child might be more ill-looking or toxic. Viral tonsillitis will be of short duration, while as the bacterial tonsillitis, the duration of the symptoms might last longer. And viral tonsillitis is mostly seen as a part of pharyngotonsillitis. This
Okay.
mostly like you see the common, along with it, patient might also have symptoms like running nose, okay,
Okay.
fever, body ache, symptoms like this.
Okay.
So these are how we can like differentiate between whether it's a viral or a bacterial tonsillitis.
एंड सर क्या जैसे हर कंडीशंस में कुछ रिस्क फैक्टर्स होते हैं, जैसे कुछ लोग थोड़े ज्यादा ससेप्टेबल या वल्नरेबल होते हैं, you know, for developing a particular condition. So what are the risk factors associated with developing tonsillitis?
See, as such, risk factor tonsillitis is the age group, I'll say. Okay, it's
Okay.
most commonly children are affected.
Okay.
The children age group, the childs are affected more than the adults. Apart from that, the risk factor says that it is whenever might be if any other person is affected by a tonsillitis, you might take up the germ from that person, or if you are
जी.
sharing some might be the food utensils, their drinks, the food, that might also lead to like patient might get the germ from this thing. Okay,
Okay.
so one is the age factor, and how tonsillitis spread is by this way, like mostly, or means any other risk factor as such as are very like it's a very common infection. So
Okay.
they're not, I can say that these are this risk, or in immunocompromised patients also, tonsillitis is fairly
Right.
common.
So basically, children and people with lower immunity, they are, they're
Yeah.
more susceptible to this infection.
Yeah.
Okay. सर, तो अब जैसे किसी को टॉन्सिलाइटिस हो गया है और वो डॉक्टर के पास आता है, तो how is tonsillitis diagnosed by a healthcare professional or a doctor?
So it is tonsillitis is mostly a clinical diagnosis. We need not do any sort of fancy tests for it. Okay.
Right. Right.
Like if you look at the back of the throat, we can see those enlarged tonsils. They might appear reddish. Okay. And along
Right.
with it, there will be the clinical symptoms with
Okay.
which the patient is presenting. If we
Okay.
further want to find out the nature of the organism causing the tonsillitis, mostly
Yes.
like the bacteria, we can send it for a culture and sensitivity testing. Okay.
Okay.
Apart from that, I don't think we need any sort of other investigation to diagnose tonsillitis.
तो टॉन्सिलाइटिस को ट्रीट करने के लिए डॉक्टर्स क्या क्या ऑप्शंस यूज करते हैं? व्हाट ट्रीटमेंट ऑप्शंस आर अवेलेबल फॉर टॉन्सिलाइटिस?
So treatment options, if you are like suspecting it to be a viral tonsillitis,
राइट.
we can just it will subside within a period of like maximum 5 to 7 days. So
ओके.
we can give the symptomatic management, like we can start for relieving fever, we can give
राइट.
antipyretics. For relieving pain, we can give analgesics. We can give the patient some warm saline gargles. So these
ओके.
are if you are suspecting a bacterial tonsillitis, the patient is ill looking, very toxic, okay, if the
राइट.
tonsils are really swollen up, so in that case we need to initiate antibiotics, okay, along with this all other medications which I have mentioned. Sometimes
राइट.
the patient might also need hospital admission if he is having breathing difficulty, because the tonsils might enlarge to a certain level that it might cause obstruction of the airway.
ओके.
So this
राइट.
is how we manage tonsillitis.
सो अब हम टॉन्सिलाइटिस के मैनेजमेंट में बहुत बार एक टर्म पढ़ते हैं, दैट इज टॉन्सिलेक्टमी. ये गूगल पे बहुत कॉमनली हमें मिल जाता है. सो व्हेन इज अ टॉन्सिलेक्टमी रिकमेंडेड एंड व्हाट डज द प्रोसीजर इन्वॉल्व?
Yeah, tonsillectomy, see, we have a definite criteria which we follow. That is
राइट.
the recommendation from the American Academy of Otolaryngology and Head and Neck Surgery. So
राइट.
they say that there are some absolute indication, there are some relative indication. So some of the common indication that are is that any person with recurrent sore throat or
राइट.
tonsillitis, like more than 7 episodes in a year,
राइट.
okay, or more than 5 episodes per year for 2 years, or more than 3 episodes per year for 3 years. That is one category of patient whom we can take the patient for tonsillectomy. Second thing is that patient from tonsillitis, if they develop some complication like peritonsillar abscess, if the patient is
ओके.
developing, so in that case we have to do a tonsillectomy. If the tonsil are enlarged to such a level that it is causing obstruction of the airway, then in that case also we need to remove the tonsils. And tonsillectomy should also be done in patient unilateral tonsillar enlargement whom we are suspecting malignancy. Okay, if we're suspecting that there is one-sided enlarged tonsil, we're suspecting that it might be a cancer of the tonsil. In that case also we do a tonsillectomy. Okay.
Okay.
Some of the other indications are also there, like the chronic streptococcal carriers, okay,
Right.
diphtheria carriers, okay.
Right.
In those cases also tonsillectomy is recommended.
Okay.
And the procedure is like mostly it is done under general anesthesia. Okay,
Okay.
patient need to undergo some blood investigations, get the pre-anesthetic fitness. Okay. After that, after the patient is induced, we'll like position the patient, will give a special position known as the rose position, and then the procedure is undertaken.
And tonsillitis, I'm sure अगर कोई ignore कर देता है, just like any other condition might progress into a particular complication. So what are those complications if tonsillitis is left untreated or left unaddressed?
Yeah, see, tonsillitis mostly there is the two types of tonsillitis. One is the acute, one is the chronic tonsillitis. So acute tonsillitis, if left untreated, will result in chronic tonsillitis. Sometimes we might also see peritonsillar abscess, which is an abscess forming within the bed of the tonsil. Okay.
Right.
Untreated cases of tonsillitis, especially in children, like they might develop some hard complications like acute
Okay.
rheumatic fever or
Okay.
subacute bacterial enterocolitis. Even
Right.
some renal complications are also there, like mostly post-streptococcal sore throat. Like
Right.
post-streptococcal, they will develop post-streptococcal glomerulonephritis. So
Right.
these are some of the like lethal complications also you can say of tonsillitis. Yeah,
Okay.
because it involves other system.
Okay. And are there any home remedies or lifestyle changes that can help, people manage or reduce the symptoms of tonsillitis?
Home remedies as such, there is no like literature that's saying that this home
Okay.
remedy is better, but people mostly they can use some warm water mixed with honey. Okay, it
Okay.
has been said that it is going to reduce the symptoms of tonsillitis. Taking
Ji.
warm gargles along with a pinch of salt to in order to prevent it. Okay,
Right.
avoiding some crowded places, wearing masks while going outside. Okay, because mostly these germs spread from person to person. Okay,
Right.
so aerosol transmission, one this germ can spread from person to person. So, or avoiding, as I said previously, that avoiding sharing drinks or foods or utensils. Okay,
Okay.
and also one important thing is changing the toothbrush frequently.
Okay.
Okay,
Okay. So, are there any technical advances that might support, the identification or management of tonsillitis?
see, for identification, mostly, as I said, it is a clinical diagnosis. But
Okay.
for treatment, yes, there are some recent advances. Previously, for doing the surgical technique, especially for the surgical technique,
Right.
previously, like the classical method was done, dissection and snare method. But now
Right.
we have got ablation,
Right.
ablation surgery, radio frequency surgery, laser surgery. Like the procedure difference is that the surgery is completed in a very short period of time by
Okay.
these methods. But
Okay.
however, the dissection and snare method is also good, but these are all other options that are available now to us
Okay.
because it reduces the blood loss also and decreases the time of surgery. Yeah.
So that was very insightful, sir. And we really appreciate your presence with us today. And I'm hoping that the enlightening information shared will be valuable to many families, particularly parents and their children who are more prone to the condition. So thank you so much for joining us today.
Thank you. Thank you so much.
Thank you, sir. And for
Thank
more
you.
such, thank you, sir. And for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.